Ovarian cancer is often called the silent killer because its symptoms can be subtle and easily mistaken for common, less serious conditions. However, recognizing the warning signs early can lead to a better prognosis. These symptoms might seem minor at first, but they could be your body's way of signaling something serious. Here are 10 common ovarian cancer signs that you should never ignore. Number 1 is persistent bloating. Bloating is a common issue, especially after eating certain foods, but when it becomes persistent and unusual, it may indicate ovarian cancer. Women with ovarian cancer often describe feeling full or swollen in the abdomen, even when they haven't eaten much. This bloating is not the kind that comes and goes but lasts for weeks and progressively worsens. The swelling is due to fluid buildup, ascites, caused by the tumor affecting surrounding organs. Many people initially think it's due to overeating, indigestion, or weight gain, but when the bloating persists and becomes uncomfortable, it's a red flag. Because bloating is a symptom of many less serious conditions, it's often ignored until it becomes severe. 2 is abdominal or pelvic pain. Chronic pain in the lower abdomen or pelvic region can be one of the earliest signs of ovarian cancer. The pain can be dull, sharp, or cramp-like, and it doesn't seem to be linked to menstruation, digestion issues, or other known causes. As the tumor grows, it presses on nerves and nearby structures, as the cancer affects nerves and other structures in the pelvic area, causing discomfort. Some women also experience a sensation of pressure or heaviness in the pelvic area. Unfortunately, because pelvic or abdominal pain is common in conditions like irritable bowel syndrome, IBS, or urinary tract infections, UTIs, it's often misdiagnosed. However, if this pain is new, severe, or lasts more than a few weeks, it's important to seek medical advice. Number 3 is feeling full quickly or loss of appetite. Ovarian cancer can affect digestive processes, leading to early satiety, feeling full after just a few bites of food. This happens because the tumor presses against the stomach and intestines, reducing the amount of food you can comfortably eat at one time. Over time, women with ovarian cancer may unintentionally eat less and lose weight without actively trying. Many women may brush off this symptom, thinking it's due to changes in diet, stress, or even aging. This symptom is particularly concerning if it's paired with unintended weight loss. If this change in appetite persists, talk to a doctor. 4 is frequent urination or urgency. If you suddenly find yourself rushing to the bathroom more often, or feeling an urgent need to urinate even when your bladder isn't full, it could be a sign of ovarian cancer. This happens because the tumor presses against the bladder, reducing its capacity and making you feel like you constantly need to urinate. Some women may even experience slight urinary leakage or discomfort while urinating. You might notice that you're going to the bathroom more often during the day and even waking up at night to urinate. While frequent urination can be caused by other, more common issues such as a urinary tract infection, UTI. However, if you notice a sudden and unexplained increase in the frequency of urination, talk to a doctor. Number 5 is unexplained weight loss. Sudden and unintentional weight loss, especially without changes in diet or exercise, can be a red flag. This type of weight loss indicates that the body is using more energy to fight cancer, or that the tumor is affecting metabolism. Ovarian cancer can lead to muscle wasting, loss of appetite, and altered digestion, making it harder to maintain weight. Many people may initially welcome weight loss, especially if they've struggled with their weight in the past. Still, it's important to recognize that unexplained weight loss can indicate something serious is happening in your body. You must see a doctor. If you lose more than 5% of your body weight in a short period without trying, it's worth investigating further. Number 6 is changes in bowel habits. Ovarian cancer can put pressure on the intestines, leading to noticeable changes in bowel movements. Some women may experience persistent constipation, while others might have chronic diarrhea or a mix of both. Additionally, the stool may appear narrower than usual, and there might be a feeling of incomplete evacuation. These digestive changes often do not improve with diet modifications and may worsen over time. You must pay attention if these changes are new, persistent, and don't seem to have a clear cause. 7 is pain during intercourse. Experiencing pain or discomfort during intercourse can be a red flag for ovarian cancer. This pain may be felt deep in the pelvis because the tumor may be pressing on the reproductive organs, causing inflammation, irritation, or even hormonal imbalances that make intercourse painful. Some women also report spotting or light bleeding after sex, which should never be ignored. It's important to pay attention if the pain is new, persistent, and doesn't seem to have an obvious cause. Number 8 is fatigue and weakness. Unexplained, constant fatigue is one of the most overlooked signs of ovarian cancer. This isn't the usual tiredness that comes after a long day, but an overwhelming sense of exhaustion that doesn't go away with rest. Even simple tasks that used to be easy, like walking up the stairs or carrying groceries, may suddenly feel like a challenge. Cancer affects the body's ability to produce healthy red blood cells, often leading to anemia, which contributes to feeling weak, lightheaded, or short of breath. If the tiredness is severe, constant, and doesn't improve with rest, immediately consult your doctor. Number 9 is irregular menstrual cycles or postmenopausal bleeding. For women still menstruating, ovarian cancer may cause irregular, heavy, or prolonged periods that deviate from their normal cycle. Women who have already gone through menopause should be especially cautious. Any vaginal bleeding post-menopause is abnormal and should be checked immediately. Cancerous growths can affect hormone levels and cause unexpected bleeding. Some women may even experience a sudden stop in their periods, which can be particularly concerning if it's unexpected. These changes occur because the cancer is affecting the ovaries, which are responsible for regulating the menstrual cycle, that should be checked by a doctor immediately. 10 is back pain. Lower back pain that doesn't go away is another symptom of ovarian cancer, particularly if the pain radiates into the legs. In some cases, the pain can also be due to fluid buildup in the abdomen, which puts pressure on the spine. The back pain is different from the occasional back pain that many experience from poor posture or sitting for too long. Unlike typical muscle strain, this pain is persistent, dull, and deep, often worsening over time. If you notice one or more of these symptoms lasting for more than 2 weeks, it's important to consult a doctor. Ovarian cancer is most treatable when caught early. Pay attention to your body's signals and don't hesitate to seek medical advice. Thanks for watching.